This part of the program is brought to you by St. Peter's Healthcare System, treating you better for life.
Welcome, listeners. You're listening to EBC Radio. This is 1170 AM. We're back once again with Heartbeat. Heartbeat is an educational program about your health which airs on EBC Radio every second and fourth Saturday of the month. I'm Dr. Dinesh Singhal. I'm an interventional cardiologist. I'm the director of the catheterization laboratory at St. Peter's University Hospital and an attending cardiologist at Robert Wood in New Brunswick and Princeton. We have an interesting show for you today, a topic we haven't discussed in Heartbeat before, something which has been in the news across the country, and that's the topic of using marijuana for medical treatment. And to help us discuss this, we have in the studio Dr. James Salwitz. Dr. James Salwitz is a very well-known oncologist in the Central Jersey area. He's a member of the Regional Cancer Care Associates practice and is on staff at St. Peter's and Robert Wood Johnson in New Brunswick. So, Jim, thank you so much for joining us today.
Dinesh, thank you very much. It's a pleasure, of course.
So I know as we were trying to prepare for the show, you have a lot of interests. Obviously, you see many patients with cancer. And it was interesting when you brought up the topic of medical marijuana because and I was trying to connect the dots. Obviously, a lot of your patients, have discomfort and pain, and then I realized the connection. This is an educational program, and hopefully by the end of this, our listeners would get a better sense of where things stand, why we use it, where it's used. So I'm going to start with having you explain to us what is marijuana.
All right. So, marijuana is, of course, a natural plant that occurs naturally in nature. And usually when we think about marijuana, we think about recreational marijuana. We think about a substance that people smoke generally in order to feel pleasure and to get high. But that's not the same thing as medical marijuana. And the difference between medical marijuana and recreational marijuana is that medical marijuana does not have much of the chemical in recreational marijuana which gets you high. And that chemical is THC. Actually, marijuana is a remarkably complicated plant that has up to 113 different chemicals called cannabinoids, and THC is just one of them. But medical marijuana tries to eliminate or limit at least the amount of THC and focus on the other cannabinoids in various mixtures and amounts. And so it's specifically cultivated and grown with goals other than getting people high.
So are there certain parts of the world where it's grown more than others?
I think medical marijuana is expanding internationally. It has actually more acceptance in some other countries than in the United States, to the point that other countries actually are ahead of us in doing research and trying to understand better how it functions. But it has a wide international acceptance and increasing use. We're not doing as much research with it yet because I think we're just kind of becoming comfortable with using it at all. But this country is expanding fairly quickly, which is very exciting for us as practitioners because I think this is a really useful technique or tool for patients to use.
So, what exactly is the mechanism? How does the product work in the body?
So marijuana, there are two receptors that marijuana targets they're in the body, and that actually results in some confusion, I think, among lay personnel, actually probably among doctors too, about what it can and can't do. So there is a receptor, a target, a place that the drug attaches to in the brain, known as CBD1. Not a very clever name, but that's what it's called. And that causes basically depending on how the receptor is attached to, a change in neurological function, a stimulation, a blocking, a change in how the brain functions and how nerves function. And then there's a second receptor, which is the source of some very interesting research going forward, but we don't know very, very much about it all, which is CBD2, which is actually outside the brain, and it appears to be involved in inflammation, and it raises is the hope that perhaps marijuana may be used at some point as a direct anti-inflammatory. And that's actually this receptor when people talk about, is it possible that marijuana could directly treat cancer, something we don't know, that people tend to focus on.
So isn't the active chemical of marijuana, the cannabinoids, some of it is naturally existing in our body also?
Right. So there's these receptors exist because there are natural cannabinoids in the body which appear to modify, in this case, alertness. They might modify pain, and they may modify inflammation. And the drug stimulates these receptors or blocks these receptors, depending which CBD, which of these 113 chemicals you're talking about, and it may change the function of those receptors.
You're listening to EBC Radio. This is 1170 AM. I'm Dr. Dinesh Singhal. I'm joined by my co-host, Dr. Meena Murthy. Dr. Murthy is the Chief of Endocrinology at St. Peter's University Hospital. And we have in the studio Dr. James Salwitz. Our topic today is medical marijuana. Our phone number in the studio is 732-297-9886, 732-297-9886. You went over a lot of the properties which this substance have. How did the thought process that marijuana, which was a drug which sometimes people look down upon because it could cause problems, how did people come around to accepting the fact that it had a medical role or a medical need in a line of work?
So marijuana has been used as a medical tool. We have information that seems to suggest as perhaps as long as 10,000 years ago. Certainly the Egyptians, certainly a number of other cultures in the Mideast, and perhaps in China, India, use this going back 1,000, 2,000 or more years. And even then, the data suggests that they cultivated it specifically for individual properties, not just to get high, but to treat medical disease, to treat symptoms. And what happened with time is people started to learn, well, this isn't just to get you high. This can help you relax, if that's important. And I don't mean relax like fall asleep, but be able to function better. It may be used to treat certain types of pain. And then other side effects such as nausea, etc. So I think there's actually a vast history. You have to remember that marijuana was part of the U.S. Pharmacopoeia, the first one, which by the way was written in New Jersey in the 1800s, the U.S. Pharmacopoeia until 1939, when it was outlawed, by the Marijuana Taxation Act, which was just an act of outlawing marijuana, and up to that point was being used by physicians in this country in various forms, both for the the psychological effects of it, but also people were looking at it for pain and for the indications. We lost it for 50 years. And I think we're now rediscovering it, and our only block is that in trying to rediscover it, we have a lot of old ideas about what people perceive as the dangers of this drug, and the result is that we lost access to something that can be incredibly beneficial, and safe.
And did we lose it then because of just politics, or was it really? If you believe in conspiracy theories, there are several conspiracy theories about why in 1939 the act was passed. So one conspiracy theory is that marijuana is not water soluble, which doesn't sound like an important thing, except it's very hard to make a pill out of. So if you're a pharmaceutical company and you're trying to make pills and you can't make a good pill out of marijuana, you may want it to go away. There's also the theory that the hemp industry, non-smokable hemp, marijuana, it can be used to make clothing. It has, that the hemp industry was threatened by it. There's even the theory that the oil companies, because you can make a biodegradable fuel from hemp and marijuana, wanted this to go away. Whether or not it was that, or truly that people became frightened and confused by what was seen as the potential dangers of this drug. But the result is that, of course, we built this entire law enforcement legal apparatus to suppress access to something that has tremendous potential for benefit.
Clearly, cancer-related pain is a major issue in the care of, patients with cancer. And we have so many imperfect ways because of various mechanisms of pain. When do you decide to use medical marijuana, in what context, and what limits, and how do you use it with the other drugs?
So we try to encourage our patients to register with the state marijuana program fairly early. We were an early adopter. Our practice was an early adopter 5 years ago. We have well in excess of 500 patients that have been on the program. And because there's multiple different possible benefits, we try to get people involved, fairly early and get them so that they have potential access, to the program. If you're talking specifically about pain, it's interesting. When we first got involved in it, we were thinking nausea, fatigue, anxiety. We weren't thinking that much about pain. But to your point, we were kind of astonished by how effective it is for many types of pain. And particular type of pain that is completely surprised me. I'm without fail again and again is pain caused by nerve damage, so-called neuropathic pain. And as oncologists, unfortunately, this is a common complication of many of our drugs and our diseases. Of course, it occurs in other illnesses as well, diabetic neuropathy. But neuropathic pain, which is the sensation, that tingling sensation that your hands or feet when you fall asleep, etc., except it never goes away. And marijuana is astonishingly effective for neuropathic pain. It is somewhat effective for injuries to tissues, such as cancer in bone. We will often use it with other medicines in complement. And one of the remarkable things about marijuana is it doesn't interact with anything else. It doesn't interact with your immune system. It doesn't interact with any of the drugs. It doesn't interact with your bone marrow, and it doesn't have any significant drug interaction. So I can have a patient who is taking a more classic pain medicine, a cancer patient on an opioid, for example, or another anti-inflammatory, and we can add marijuana to that without any concern that we're going to increase side effects or complications. And many of our patients find that they're able to reduce the use of opioids and other drugs, by using marijuana.
So is marijuana as addictive as the opioids? I mean, we're going through this opioid crisis, and I guess one of the reasons why, even though there was a conspiracy theory, it may have been gone into disrepute as the misuse of any of the drugs which could make you go high. So one, is it addictive? And two, how do you I guess let's start with how is it addictive?
So marijuana is not chemically addictive. It is not an opioid. It is not a narcotic. There's not chemical dependence. People will say, I know a 16 or 18-year-old uses it all the time, and he seems to be stoned all the time, and it's so that is maybe would be more personal, emotional. It is a concern about recreational marijuana in teenagers. But marijuana itself has no addictive properties. And so it can be started or stopping as you need it, without there's not even the smallest, there's no withdrawal from it. It also, has no LD50, the medical term, which is to say you can't overdose on marijuana. Hundreds of patients in the United States every year overdose and die from Tylenol overdoses. There's never been a single reported death from marijuana overdose in the medical literature. If you take too much marijuana, you will probably fall asleep. But on the other hand, it doesn't cause changes in breathing. It doesn't cause heart effects. So there's no maximum amount. And it does not cause addiction or dependency. There is an interest, but really an unknown about the use of marijuana, for as an opioid, as part of the answer to the opioid crisis. And there's very little literature in this area. Clearly, patients that are opioid addicted, marijuana is not the answer to that. I mean, you need, then you have to looking at more complicated methods and drugs and stuff to support them as they get off opioids. But there is some thought that perhaps, if as marijuana becomes more widely available, that people will use less opioids, and therefore on that front end, may result in some decrease in opioid use. And there's some evidence as marijuana has become legalized in different states that this may indeed be happening.
There is an issue when there is an availability for a specific use or a prescription use, like in Colorado, what's happening now. Then the next stage is recreational use, and next stage is, now the bill is being passed for it to be delivered into people's homes. So people worry about its effects on its use, on teenage brain, on developing brain, and what are the issues related to it? Is it a gateway drug to other narcotics? Not for the patient who is using it at home, but maybe the grandchild or maybe other members of the family, just like how prescription drugs that we give to the seniors are being used by teenagers at home.
Well, but I think those are really important issues, critical issues, and I think there are two issues there kind of at once. I mean, one is in the prescription of any drug that has potential side effects, potential abuse. So, as physicians, we are bound, to make certain that we prescribe them safely. So, just like if we write for any other medicine, I think it obligates us to say, these things should be locked away. These shouldn't have easy access, etc. My wife is a big proponent of lockable pharmaceutical cabinets, etc. So, so that you can't, no one can get the drug. And I think with marijuana, with medical marijuana, I think this is something we have to educate our patients, and we try to do so. The amounts that we're prescribing to them they're not that large that they would easily be have wider use. And the other thing is important to remember: medical marijuana will not get you high. So if
and why is that?
Because it has fairly low amounts of THC. And actually tends to have higher amounts of CBD, which is actually the balancing. So of the 113 chemicals in marijuana, one is THC, which is what gets you high, stimulates the receptor in the brain. And the most other one common people think about is CBD, which is actually the other way, is a suppressive. And medical has very little THC. So the average teenager happens to get a hold of medical, actually he'll be sorely disappointed.
So is the plant different, or it's extracted from the same plant and then it's modified after the fact?
No, the plants are different. There are about 65 different medical marijuana plants presently registered in the state of New Jersey. About 25 are being grown at any time. So the plant is actually different. But the other thing you asked about, which is very important conversation, because we talk about the teenage abuse and the question of a gateway drug and everything like that. And of course, we're starting to talk about really is recreational.
Yes.
So the medical marijuana is legal in New Jersey. There's a new medical marijuana bill that's about coming out of the Senate and the Assembly, which is just improving, I think, the program in some ways. It changes it, but not in some gigantic way. But the other thing, of course, being debated and trended right now is recreational marijuana. Mm-hmm. And I think it is probable that we will see recreational marijuana approved in the state of New Jersey, likely in the next several months. I don't know that, but it is likely. So, the State Medical Society, of which I serve on the State Medical Marijuana Task Force, has taken the position that if they had the power to choose completely, they would say we'd rather people didn't have access to mind-altering drugs in general. But having said that, it's likely that recreational marijuana will be approved. The Medical Society's position is that they want controls put in place so that we can't get it to teens, or young adults. That we're doing education about driving, while using recreational marijuana, because it can make you high and affects the use of motor vehicles, and other controls in place to try to protect, people from the possible risks of marijuana as it likely becomes legal. I think one of the main exciting things, positive things about recreational becoming legal is the whole social justice issue, because we're by far individuals that are arrested and incarcerated for the use of recreational marijuana in our state, as in almost all states, are individuals of color. And this is obviously an ethical and moral abuse, and we can do a lot better. So I think that's a very positive thing as far as legalizing it. But on the other hand, I think the Medical Society's position is that we have to be careful as we establish controls. The other question was the question about, is it a gateway drug? So, I mean, and I guess in a gateway drug, in my mind, that means I start using it, I get this feeling that I want something that could get me stronger and stuff, and therefore I'll start using something more dangerous. I think the available evidence says it's not a gateway drug medically, chemically. It's not like I can't get high enough, so I'm going to start using crack cocaine or something else. But it is practically, because the person that's selling marijuana is selling a drug that only has about a 10% markup. They can't make a lot of money and is not addictive. But if I can get you over fentanyl, if I can get you, if we can get you just, if a drug dealer can get you to start using crack cocaine or something, you're going to get addicted to that. The markup on that is hundreds of %, and I'm going to make a lot of money. So the hope is that if you separate the sale of recreational marijuana from these other drugs, that you may be able to prevent part of the opioid crisis.
You're listening to Heartbeat. This is EBC Radio. We're talking to Dr. James Salwitz. He's an oncologist, and our topic today is medical marijuana. The phone number in the studio is 732-297-9886. You started mentioning about registration. So it looks like there are certain steps which have been implemented to minimize the misuse of this drug. So walk us through the steps which someone has to take in order to be able to get the medicine, or get the medical marijuana.
So the process is simple. It's a little annoying because there's several steps to go through, but it's not difficult. So there are now close to 1,000 physicians in the state of New Jersey that are registered to prescribe medical marijuana. So what has to happen first is you go to one of those physicians, and if you go on the state medical marijuana site, their names are listed. And plus, if you a lot of times just reach out to your local physician, like if you reached out to our oncology group and say, is anyone in the group? There's several of us in our group that are registered with the program. And then you go sit down with that physician. You have to have a review of the medical records. You have to have some sort of relationship with that, with that physician. And you have to have diagnoses that fit specifically in the program. Now, so marijuana is interesting because the state has defined which diagnoses you can write marijuana for. That's unlike any other medicine that a doctor prescribes. If every other medicine that exists, if the FDA says the drug is safe and available, a doctor technically can write it for anything they want, and it is their responsibility under their license. Right. Marijuana is reversed. Marijuana, the state has said these are the specific diagnoses that you can, because it's approved for, and you can't write it for anything else. At this point, those diagnoses are fairly broad. There's about 15 of them. They obviously include cancer, they include AIDS, they include multiple sclerosis, they include intractable seizure disorders, they include glaucoma, they include several different definitions of pain, they include anxiety, they include muscle spasticity. And you have to have one of those diagnoses. And so you sit down with the physician, which takes a fairly short time, and the physician confirms you have one of the diagnoses, and then the physician registers you with the program. And what the physician's basically doing is just that, confirming you have a diagnosis which fits under the program. The physician also writes the amount you can have access to, but that's very flexible, and a lot of patients will actually buy less than the physician's allowed to approve. But the most important thing is that they're confirming it's a diagnosis. So that gets you registered with the state, gives you a state registration number, and then you have to go online and to the state website, and basically what you're doing is proving you live in New Jersey. One of the challenges we've had actually is we've had people visiting from other parts of literally the world. And we had a young man not long ago visiting us from Israel who had cancer and was under treatment here and had received marijuana in Israel, but because he wasn't a New Jersey resident, couldn't get marijuana in New Jersey. And he was getting it in Israel. So you register and it proves you live in New Jersey. And then you get a card in the mail. It's kind of like a driver's license card. And then you call one of the marijuana dispensaries in the state. There are presently 5. The new bill is going to rapidly increase that number. It may actually be it being a dozen, maybe 2 dozen, because they're redefining it so it's smaller places. And then you'll go to one of the centers and sit down with a trained marijuana counselor. And they go through this, and they have not only the experience with the product that they're growing there, but they also are trained. And they'll sit down with you and say, what are the symptoms you're having? I'm nauseous. I'm anxious. I'm having pain.
Well, just hold that thought. We'll be back right after this commercial break. Folks, you're listening to EBC Radio.
EBC Radio would like to thank St. Peter's Healthcare System, treating you better for life, for sponsoring the preceding program of Heartbeat Show.
We know finding a good doctor, someone you can trust, is not easy. But now you can find St. Peter's Physician Associates, a network of primary care doctors and specialists, at Fairways Town Center on Stelton Road in Piscataway, offering evening, weekend, and walk-in hours. To book an appointment online, visit sppanj.com or call 732-339-7575, 732-339-7575.
This part of the program is brought to you by St. Peter's Healthcare System, treating you better for life.
Welcome back, listeners. You're listening to EBC Radio. This is 1170 AM. Program is Heartbeat. This is an educational program about your health, which airs on EBC Radio every second and fourth Saturday of the month. I'm Dr. Dinesh Singhal. I'm an interventional cardiologist. I'm joined by my co-host, Dr. Meena Murthy. She's an endocrinologist. In the studio today, we have Dr. James Salwitz. Dr. James Salwitz is an oncologist. He's a member of the Regional Cancer Care Associates and has been in practice in the Central Jersey area for many years and is on staff at St. Peter's and Robert Wood Johnson in New Brunswick. Our topic today was medical marijuana. The phone number in the studio is 732-297-9886. So we left off, you were walking us through the process of how someone is able to get it so that they have access to it without it getting misused.
Correct.
And we went through the process of the physicians who are registered in the state of New Jersey. The patient has to register with the state, and then how does the patient eventually get the drug? Do they go to a pharmacy? Is it picked up in a physician's office? How is that controlled?
So marijuana right now is being grown in 5 dispensaries in the state. The new law will expand that number quite a bit, but right now there are 5 different centers, and they grow on site, which is how the original law was written. For those it's important to is GMO and it is organic. You know,
what's GMO?
No, it's genetic. It's not genetically modified.
Oh, okay.
Not genetically modified,
okay.
and it is organic.
Okay.
I saw a patient actually ask me that about a year ago. Well, is it organic? I go, I had no idea, but I looked it up.
But it's not in Whole Foods.
It's not Whole Foods. That's exactly right. So basically, you'll get the card. So the doctor registers, you register, you get in the card in the mail, which looks like a driver's license card. You call the center that is nearest to you, or there's another center that you want to use. And then you'll get an appointment, and you'll go and sit down with one of the marijuana counselors, who go through a whole training program. Plus, they're very aware of the products that they have. You know, this is a plant which people are growing, and it's like anything else that's farmed. You know, there are various times and seasons. They may have more of one, less of one. Sometimes they run out of one. I mean, it's so they know what they have in stock. But as there are about 25 different strains being grown at any time. And what the counselor will sit down and will say, you know, what is it you're experiencing? Is it pain? Is it nausea? Is it fatigue? Can't sleep? Is it what's happening? And of course, they will also get this information from one of the doctor's note that goes to them when they're registered. And then they'll say, okay, our experience is, and there's some science, but a lot of experience, that these particular forms of marijuana, this particular strain, would be good for your particular condition. You know, what the difference is is that as I said, there are 113 different cannabinoids. The average marijuana plant has about 70. Most of them have very little THC, but they have different levels of the different chemicals within them. And by changing those chemicals, really makes it's an astonishing difference about what this is good for, what it changes. Is it good for anxiety? I just need to rest more. Is it good for nausea? Is it good for pain? And the council will say, we have experience with this strain or this other strain, and this is what we would recommend you using. A lot of patients use more than one at different times in different situations. If I have a patient who has a neuropathy, pain, and they get up in the morning and they use it, that may be good through the day, but they may want something stronger at night so they can sleep through the night. Or maybe they use one particular thing for nausea around the time they're getting chemotherapy, but then in other times they're using something else as far as anxiety and just trying to deal with very difficult diagnoses, for many patients. And so the council will then work with them, okay, which strain. And then the council will say, how do you want to do this? So I have patients that if you could think of a way to use marijuana, I have somebody doing it. It's incredible the variation, and the councils work with them. You can smoke marijuana in the old-fashioned way. I have very few patients that do. People don't want to be perceived. People that are sick of cancer or the diseases don't want the smoke. But I have a lot of patients use a vaporizing device. Vapor. It's a moist vapor, kind of like an inhaler. And that's a very common way. And people like that because it works within minutes. It's very easy to adjust the dose. 3-4 minutes I use it, etc. How do I feel? I can use a little more, a little less, and adjust that. And then as soon as you let go of the button on the device, it stops making the mist, so it's very efficient. But then I have also people that use oils under the tongue. We're seeing more and more use in New Jersey now of topicals and lotions and creams. I have people that make brownies and cookies, etc. And I have one gentleman that I met, it wasn't my patient, I guess he figured out, and this is true, how to make a suppository out of it. And this was, when I heard the story how he did it, it was like incredibly complicated. So if there's a way to do it, people do it. And then the marijuana counselor says, so what do you need as far as equipment? I mean, contrary to most, I think, what most people thought, almost none of my patients who come in for this have used marijuana before. I mean, I have 95-year-old women that come in, and they're beat up and sick because of the disease process who've never used marijuana, and their kids or grandkids maybe so want to use marijuana. And then I have every other age in between. And most people don't have an extensive experience with marijuana or maybe no experience at all. So the counselors teach them. They help work with them. Is there any equipment they need? If they're going to be cooking with it, or they're going to, how do you do that, et cetera? And they walk them through. And then they actually buy their marijuana right there from them. This is against federal law, not against state law. It is against federal law. And what that means is that no insurance anywhere pays for this. Medicare and Medicaid, no insurance anywhere pays for it, anywhere in the United States at this time. And it's just, it's the way it is. Depending how much you use, most people end up being in the range between $100 and $200 a month. Less, more. If you use a lot, it could be more expensive than that. Incredibly, they do have sales, which is amazing to see a marijuana sale. And they do have, different discounts, etc. But, you do have to pay for this. And insurance does not pay back. So then you get the marijuana. They work with you whenever the equipment is. And then, I think there's a learning curve. How often do I use this? How much do I use it? When do I use it? What is there particular times that I'm feeling worse that I want to use it? But again, one of the great things about marijuana, unlike almost any other medicine that we use, is that because you can't overdose on it, because it's not addictive, because it doesn't interact with any drugs, you can feel very safe and comfortable kind of figuring out what is best for you. Exactly, how often, and you use that to get the symptom relief, that you are trying to get. When we've had patients that this has not worked on, it's usually been for one of two reasons. One, they tried it kind of once and they didn't like how it went and they just kind of dropped it, or didn't feel like it helped because they maybe didn't use enough. Or two, maybe it wasn't the right strain. And it kind of hit them a little bit too hard and they get anxious, they get anxious about this. But I have hundreds of patients whose lives have been dramatically changed by this, dealing with pain, dealing with nausea, being able to function, getting through, cancer therapy or getting through other illnesses. I had a patient who coincidentally was just in the office 2 days ago, who had a severe neuropathy, nerve damage from having a bone marrow transplant. which was making his life almost unlivable. Basically continuous severe burning of his hands and feet, and work was almost impossible for him. It basically was. And was taking $2,700 of pain medicine a month. So, any of the pain medicines that we're familiar with, he was taking all at once. And we got him a medical marijuana, this is a couple of years now, and that's all he takes. Everything else is, it was stopped, and he went back to work, and he was able to function, and he's really regained his life. And that's not an unusual story. We see remarkable, benefits, for this. And just helping patients get through the cancer journey. I mean, cancer is frightening, overwhelming, complex at so many different levels. I mean, one of the most unfair things is at the same time you're trying to make some of the most complicated decisions in your life, you also feel terrible. And this is just a tool that you can use to help you feel better as you walk through it and keep control of your life and keep independent. As oncologists, the last thing we want to see is someone go into a corner and become, the kind of pale, weak, fragile cancer patient. We want people living their lives. We want people with their children. We want people out. We want people working if they can. And then marijuana turns out to be one of the tools that helps people, get through the cancer journey. It's been really a remarkable thing for us.
You're listening to Heartbeat. This is EBC Radio. We're talking to Dr. Jim Salwitz. He's an oncologist. Topic is medical marijuana. Any comments, questions? Phone number in the studio is 732-297-9886. Almost every drug we use has side effects. Does this marijuana have side effects to be worried about? I
mean, I think the side effects are fairly minor. If you take too much marijuana, you'll fall asleep. I mean, that's what you'll get sleepy. I've had patients complain that it made them feel anxious. I think that's a very unusual side effect. It's not anxiety producing. And most people, I've had patients feel that it just hit them too hard. And of course, patients, who don't want to, the way to deal with it physically, whether it's smoking or it's, those can make, things challenging. But I think it's a fairly safe product, and it's certainly safer than almost every other drug that we prescribe.
So, in our practice, in endocrine practice, we see a different, not the medical marijuana part, but, recreational marijuana use and impacts of that. So I see very much of cognitive dysfunction in, young people. So people who are using medical marijuana, which is very different, functional people who are in their 40s, 50s, and they're still working and they need high level of, comprehension, cognition. Do you see any differences once they start using?
I think the short answer is not really. But the better answer is, I think it's something you have to figure out how often you're using it, when you use it. So the strain of marijuana that someone might use for anxiety, that's one of the indicated diagnoses in the state is just pure anxiety. That is likely to have some significant, more sedating sort of effects. And if someone was using that on a very often basis, it might make them less sharp. We do talk to people about the warnings of, using it and driving, using it in machinery, particularly if they're noticing sedating sort of side effects. But as a general rule, no, we think actually probably the opposite. And that is that if you're feeling really beat up or whatever is happening to you medically, this is something that lets you get up a step. A lot of patients, very, very commonly, patients will come to me and they'll say, listen, we want to get marijuana because I want to use it to cure my cancer, to treat my cancer. That I've read on the internet where everything is written, everything's possible, that cancer can be cured with marijuana. And there is no such research that says that. There's some work being done in Tel Aviv. There's some work in Australia, a little bit of the Italians, trying to see if there may be a way to use marijuana to directly treat cancers. But at this point, there's no such evidence. But what is clear for any illness, that it helps, is that it helps people function at a higher level. So if you're a cancer patient and you're not eating because of the treatments or the disease, then you're losing weight, then your nutritional status is depleting, then you're not healing wounds, and that is just a bad thing. Your prognosis is worse, the way you feel is worse. And marijuana may be a way in which to help get over that. You may be able to eat better, and that keeps your functional status higher, and then maybe you can get out and exercise, all the things we want to see patients do. So if marijuana has a net benefit in treating cancer, it is in helping people deal with the diagnosis, deal with the complications of the disease and of the treatment, and be out and around. We also, we're talking about curing cancer, long-treated cancer, but this is also, it turns out to be something that's really beneficial in end-of-life care, in hospice medicine. It allows people to function better. I mentioned a 95-year-old lady. I had a 95-year-old patient about a year ago, who was very much at the end of her cancer journey. The disease was increasing, and she was dying, and she had pretty much taken to bed. And one of his family members called me and said, one thing that she's upset about is that she's going to miss her granddaughter's wedding, and won't be able to get out to do that because she can't function. And the son asked you, do you think marijuana would help? And I said, I don't know, but it's worth trying. And so she got out of bed. She went to that wedding. She ate at the wedding. She danced, at the wedding. I'm not sure how vigorously, but she danced at the wedding, and she was able to get out and live that part of life, because end of life is part of living. We want to see people be involved and with their families as much as possible, no matter what happens to them. And she was able to get out and do that. And so we're seeing also the use of marijuana in palliative care, in comfort care, in end of life care.
And clearly they can tolerate the treatment, which is pretty sometimes caustic, much better, because people stop chemotherapy and other things because they just can't tolerate it. And if Absolutely. They are able to keep through their treatment, they can beat the cancer many times.
Absolutely. There's a side thing we should talk about that people have confusion of. In fact, I get this question all the time. So there is a over-the-counter online product available, which is CBD oil. And a lot of people get access to it. And CBD oil is widely available. There's some debate whether it should be legal or not, but at this point it is legal. So CBD is one of the 113 cannabinoids. In theory, it's the opposite of THC. THC is the stimulant, CBD is the blocker. So CBD is kind of like Valium. It's a sedating agent. And a lot of people try to get CBD oil to use in this space to try to help them, with cancer diagnosis, other diagnoses. There's nothing wrong, I think, with trying it. The concerns that we have with CBD oil are two. One is that if you look at the studies looking at what's actually available out there, and people have bought CBD oil from, 13 different places and then tested them, it ranges from things, from CBD oil to things that have nothing but olive oil in them to everything and all sorts of other chemicals. So it's a very variable product. And the second, this is just a sedating agent. This, that's what CBD is. And it doesn't have all the other benefits that we've been talking about. So that there's not really a downside to trying it, I guess, except that the high variability in what are you actually getting. But medical marijuana, even if you're making it into an oil, or a butter, which people do, is in our experience, a far more beneficial product.
So when someone comes to you and they have pain today, is that your go-to product, or do you use other analgesics and opioids to help with the pain? How do you make a selection of what you would use?
It depends very much on the type of pain. It depends on, the answer is all the above. We continue to use, opioids, anti-inflammatory, steroids, direct treatment of the cause of the pain, obviously, radiation, surgery, neuroleptic drugs, which block nerve signals like gabapentin and Lyrica. But marijuana is more and more something we try to have on board. At this point, when I am seeing a new cancer patient for the first time and just starting to get organized with things that we want to do, I encourage a lot of them, to register for marijuana, even if they're not going to start using it at that time. I'd like to have them registered in the program, which takes a couple weeks to get through the different steps. And so I try to get them involved early so that we have that alternative available.
Now you mentioned counselors. What's their background training?
It's a certification. And the individuals before that, they may have a wide range of backgrounds. A lot of them originally have come out of actually the whole marijuana, the recreational marijuana industry in other states, et cetera. And then they've come here and they started, growing medical marijuana centers. But there's a multi-month training program and ongoing certifications that they have to, and then plus a key part of this experience with the products that they have.
So when you are prescribing it, are you specifying the exact strain, or you leave that up to the counselor at the pharmacy?
And we leave it up to the counselor, the pharmacy. They know the products they have, the experience with it. This is not yet a true science. So when you write for a blood pressure medicine and it's exactly 50 milligrams, and we know the exact amount, you're getting a pill that basically has one chemical in it, maybe two. Marijuana is a whole range of chemicals, up to 70 in a single plant. And we don't have good objective research yet about which ones cause which benefit in which situation. Because marijuana is against federal law, it's a Schedule I drug in the United States, which means it's classified like heroin, cocaine. And there's been very little research on this in the United States. Now, the Australians are doing some elegant research on marijuana as far as seizures. The Israelis are doing a wide range of research. The Italians are doing research where we have fairly limited. One thing about the new medical marijuana bill coming out of Trenton is they've tried to put some protections in place so we can start to do some research in this area. One of my partners at La Citra, who's a biochemical engineer before he went into medicine, he this drives him nuts because he says we should be able to say it's 30 milligrams of this and 5 milligrams of this and in this, et cetera. We should be able to do it as a science, and I think we'll get there. I think we should get there, but at this point, no, there's a lot of experience with the individual product, and the patient has to kind of deal with it, ingesting it.
So that means when you're writing it, you're just writing that this patient should get marijuana, but you're not specifying the dose, you're not specifying
the type.
The type. So
Right.
you're just saying it's for this indication and that this patient should get it. So you're not in control of how much they're getting and for how long they're getting.
Right. It's very peculiar how it's come into the medical community. This came from a different path. As physicians, we don't get any credit for this. There are other things in medicine that this is a groundswell that came from patients and from the community in general, and then eventually from the legislators. So it didn't come from the FDA, who still refuses to look at this or study it. And so it came from a different direction. So correct. What the physician does is certified. There's a diagnosis or state law, and certifies a maximum amount, which is up to 2 ounces right now in New Jersey. It's about to be increased to 3 or 4 ounces, which, for context, is a lot of marijuana.
So could that person run out of it in 2 weeks but you intended to give it for 2 months?
Yes, and that happens to me. I get a call. You prescribed half an ounce. I used a half an ounce. Particularly if you're cooking with it, it consumes more of it.
Oh, you cook with it too?
Right, you can cook with it. You can make oil from it. There's a machine called the Great American Butter Machine. That's what it's called. It looks like one of those old bread makers that you have, et cetera, except you throw the marijuana in, you throw some oil in there, you push the button, and you get the marijuana oil or butter out of it. And then you can cook with it or use it as you want. So you can definitely cook with it.
It's amazing how much I learned today. And as a cardiologist, we help pain by putting balloons and stents, and it's a totally different world out there. And I think along with you, obviously you're in the forefront, but still learning, and a lot of us have a lot to catch up with.
Yes, it was something that we don't regularly use in our practices, so it is still novel to us. There's still, a lot of myths and misunderstandings about this.
So we have 30 seconds, Jim. So in 30 seconds, if you can just tell our listeners, if they're suffering from what kind of conditions, should they reach out to either their primary care physician, who can put them in touch with somebody who prescribes marijuana?
So pretty much any sort of pain right now. There's actually several classifications, but pretty much any sort of pain now falls under it. Intractable seizures, intractable muscle spasticity, intractable symptoms of multiple sclerosis, terminal disease is actually a classification. Complications of cancer or cancer treatment, complications of AIDS or AIDS treatment. Glaucoma is classified. And those are the major indications now that will be expanding, soon.
Well, thanks so much for joining us today. We had Dr. James Salwitz. He's an oncologist with the regional
WWTR Bridgewater.
EBC Radio would like to thank St. Peter's Healthcare System, treating you better for life, for sponsoring the preceding program of Heartbeat Show.